For partners, this module is for the other parent or your partner. Moms can definitely watch it, but this section is made, first of all, if you're the dad, partner, or other mother, I want to thank you for watching this. Just the act of agreeing to see this and turning it on means you're listening to the mom and you want to be a fully supportive partner. This will make a huge impact on how you can strengthen your relationship more deeply and bond with your baby. So good job, you're off to a great start. I just want to add that most fathers today are fantastic. Modern dads are hands-on, they're fully involved, they understand how critical their relationship is with their baby. You're nurturers, decision makers, meal planners, all of it. Your dedication to fatherhood benefits your child so much, and it strengthens your relationship with your partner. But parenting is exhausting. Caring for a baby is beyond a full-time job. Even an easy baby is a ton of work. Literally 24/7 round-the-clock care. That's adding 3 full-time jobs between the two of you. You're both going to be exhausted at times. If your partner's breastfeeding, she will have periods of sleep deprivation that can affect her ability to think and function well. A few nights of bad sleep is one thing, but over 100 days in a row affects your entire sense of wellness. If you work outside the home, it can be difficult to realize how hard it is on the mom at home with the baby. While you're at work, you may be tired and stressed and looking forward to nothing more than getting home and spending some time relaxing and being with your new baby. So it can be surprising to come home and find the mom looking frazzled and desperate for a break. Keep in mind, many of the stay-at-home mothers I work with dream of having a day back in the office, wearing professional clothes, having adult conversations, and contributing meaningful work related to their professional training. It doesn't mean they don't love their babies or being a mom. It just means that parenthood is a long, hard job. Because parenting is so much work, both parents often feel like they are doing more than their fair share. At times you will support each other, and sometimes you will frustrate each other. Don't expect your partner or yourself to be perfect. Be gentle and forgiving with yourselves. Neither of you can read each other's mind. Check in with each other often about how you can best work together. When you approach this as a team working to parent your child and support each other, parenthood can make you much closer as a couple. Most importantly, there are things you can do to help prevent depression in both yourself and your baby's mother. About 1 in 7 moms get postpartum depression, PPD, and it may surprise you to know that about 1 in 10 dads get it too. The diagnosis of PPD is often missed in men and probably as well in other mothers. The great thing is there's so much partners can do to help prevent PPD and to increase enjoyment you both have of your baby. This section covers techniques to strengthen your relationship as parents and simple ways to support each other. Recognizing signs of depression. Depression can make someone who's normally energetic and capable become easily overwhelmed. It can make a person exhausted. It can be very frustrating to be in a relationship with a depressed person. They just don't seem to be able to do very much. It can look like they're being passive-aggressive when really the depression is draining every ounce of purpose from them. If you find yourself getting frustrated, recognize they're probably feeling that same frustration about themselves. Depression, not the mother of your baby, is the enemy. You're both dealing with the painful ramifications of depression. Depression can also make someone irritable or filled with rage. It can be very easy to be caught up in an argument or can feel like they're only pointing out your failings. The self-loathing that depression creates within a person can be reflected onto others around them. If your partner is acting out of character, ask yourself if this might be a sign of depression. It may also be a sign that she needs more help and support. Educate yourself about postpartum depression. Understanding what your partner is going through will help you respond to her in a more supportive and empathic way. While you can't fix this for her, you can be part of the solution. You can help her feel less alone and make sure she is getting the care she needs to get better. To get a better understanding of PPD and what your partner would need, you will find the first few modules of this course helpful. On top of this, postpartum.net is another great resource for those looking for coping skills and a better understanding of the condition. Support mom's recovery. Think of the baby in the home as shared responsibilities. Don't think of the baby as her responsibility and that you're merely there to help as requested. Often moms become the default parent. As a team, it's important to have conversations about good ways to balance the household responsibilities and childcare. Maybe that's doing the laundry, the dishes, or lessening the burden of more mundane household tasks. Talk with her about what is helpful for you to do. Don't wait for her to ask you to help. Look around and see what needs to be done. Maybe make her meals. Be flexible in your household roles. Do things that are normally her job. Take as much off her plate as you can. Partners that don't adjust their roles and take on more responsibilities without having to be told often end up with a resentful spouse. If she has anxiety over leaving the house with the baby, offer to join on initial trial run outings. Although she probably never had anxiety about going to the grocery store before, going with a new baby can be stressful. Parents often worry, what if the baby needs to feed while I'm there? What if the baby cries the whole time? What if the baby needs a new diaper? Add sleep deprivation and depression, and the thought of going grocery shopping with a new baby becomes completely overwhelming. Doing the first trips together allows you to give each other support while you learn these new skills. Being in all of this together can make it much less overwhelming. Talk to your partner before inviting people to your home. It's your job to set limits with visitors, especially people who are difficult for your partner. Is your brother or mother a challenging person? Are they critical of the baby's mom? Do they have a habit of making your wife or you feel upset or bad? Do your parents think PPD is made up? Do your parents give backhanded compliments to either of you? Do they expect to be waited upon rather than be helpful to you? If the answer is yes to any of these questions, your obligation is to protect yourself and your wife. The last thing a depressed new mom or exhausted new parent needs is to be alone in a room with a critical mother-in-law. Even fantastic, well-intentioned parents can be draining if they're in your home for too long. You can avoid a tremendous amount of marital strife by talking together and creating a plan on how to handle visitors. Attend her OB appointments with her if you both think that would help to give her doctor the full story about how she's feeling. Some moms look too good to be depressed, yet we know that how someone looks may have nothing to do with how they feel inside. Maybe attend your baby's doctor's appointments so you're both on the same page about your child's health and development. Help her to get out of the house and away from the baby for at least 15 to 30 minutes a day. Supporting her and getting time away is enormously helpful in improving her mood. This provides time for her to lessen her baby radar. Offer to watch the baby so she can meet a friend for coffee, go to yoga, take a walk, or buy groceries without bringing the baby. This time away allows her to remember who she was before she spent every waking moment taking care of a baby. This also gives you time to develop your own caregiving style with your baby. Encourage, but don't demand, her to come on walks outside with you and the baby. This helps her get exercise, have positive time with you, and get out of the house. All three are helpful in preventing and treating depression. Learn childcare skills without usurping her confidence. Be an active partner rather than just an assistant. Learn how to change diapers, give a bottle, calm your baby, and put your baby to bed. Learn your baby's cues so you can tell by looking at her or him that it's time for a nap or a feeding. Check your baby's diaper periodically so you know when it's getting full or wet. This takes some weight off of the mom so that she isn't always having to tell you what to do or orchestrating all childcare. At the same time, communicate what you're doing. Check in with each other. Tell her when you see your little one is looking tired and ask when he last napped. If he's making signals like he's hungry, ask when he last ate and let her know you think it might be time. See what she thinks as well. Communicate and be a team. Sometimes when we learn a new skill, we express our pride in ourselves. Normally this is super fine to do. It's great you're learning dad skills and you should be proud of yourself. Can you swaddle like a pro or get your baby to giggle every time you hold him? Have you mastered the 5 S's? Awesome, way to go. You have a lucky little baby. However, mothers with PPD often feel like failures, even when they're doing great. When a woman is depressed, everything feels difficult and overwhelming. If you were talking about how easily you can change a diaper one-handed or get the baby to stop crying, sometimes her depressed brain hears this as proof that she is an even greater failure. So go on and be proud of yourself, but keep it to yourself for now. Instead, focus on ways to make her feel good as a mother. Ask her what it's like for her to be home with the baby all day, every day. If we learned anything from shelter in place during the pandemic, it's that staying home day after day can become boring, depressing, frustrating, exhausting. Shelter in place reminded me a lot of my time at home with my new babies. Long days doing tons of housework and feeling like I'd accomplished very little at the end. Craving to get out, yet anxious about simple errands such as trips to the grocery store or the pharmacy. Going shopping with a new baby is a lot like learning the routine of social distancing. You are completely preoccupied with safety and feel judged for whatever steps you choose to take or not. All of this is happening while she is utterly exhausted, still recovering from her body being distorted and stretched, and suddenly realizing she has ultimate responsibility for the care and welfare of a new being. The more you can put yourself in her shoes, the less alone she will feel. Assure her you share the weight of this responsibility. Seek an understanding of what this experience is like for her. You might not understand exactly how she feels, but you can certainly try to by listening without judging her and without dismissing her emotions. Try not to invalidate her experience by saying statements like, "It can't be all that bad." Instead, be curious about what she's feeling and how it's affecting her behavior. Listen to her and take her feelings seriously. For example, "You must be exhausted after getting so little sleep for so long." Or, "We've been through a lot. How are you coping? Our new baby's a handful. How are you doing? You do so much for the baby all day long, day after day. How are you handling all this?" Express empathy, not sympathy. There's a difference. To empathize is to demonstrate an understanding of how someone else feels. It's the attempt to imagine what it might be like to walk in her shoes. Empathy is an expression of joining with another person. It implies that you are trying to understand what she is feeling right now. By connecting deeply with her, you validate her experience. It makes her feel more supported and less alone. Whereas sympathy is recognizing that someone feels bad, but not imagining what that would be like. Sympathy is not a joining reaction, but is often actually distancing. It can be summed up with the expression, "poor baby." It implies I'm doing fine, but you're not. It can leave her feeling more alone. Empathic and validating statements include, "I'm so impressed with your persistence in figuring out what our baby wants." Or, "I see how hard you're trying to make sure our baby gets enough to eat. It must be really scary to have such upsetting thoughts." Sometimes expressing your own challenges can help her feel less alone. "Hearing our baby cry for hours is really stressful. How are you managing it?" Or, "Sometimes I don't know what our baby wants. How in the world can you tell?" Another option is, "Sometimes I have no idea what I'm supposed to do. Do you ever feel like that?" Express confidence in your partner's ability as a mother. Depression makes mothers feel like failures. You've probably known your baby's mother when she was not depressed. Remember what she's normally capable of and express your belief that she will be able to get back there. Notice her strengths and remind her of her importance to you and your baby. She may not be able to believe you right now. Hold in your own mind that she can and will return to the person she was before PPD. Remind mom of her strengths and show your appreciation. I can see how hard you are working to overcome difficulties with breastfeeding. Or, you're so amazing when it comes to knowing what our baby wants. Thank you so much for taking the baby to the doctor. Maybe you're worried that because your baby's mother is seeing this module and has taken this course, that your efforts will feel fake or forced. And that's okay. Saying these things demonstrates that you are trying to do your best to support her. Just as she may be struggling to do the right things as a parent, so are you. She can help guide you to give her meaningful support. You are in this together. Take parental leave. Until you've truly walked in her shoes, don't think you understand her full situation. One way to get a better sense is to be home, taking on all the responsibility of the baby, which includes laundry and household chores. When both parents have experienced what it's like to care for a baby for days at a time, you develop a greater appreciation of the challenges of parenting a newborn. Couples that both understand the full ramifications of the care required by a baby are better at supporting each other. In addition, this intensive time helps you learn your baby's care routines, allowing you to be a more present parent and establish better bonding with your child. Speaking of bonding, don't plan to travel for the first 2 to 3 months after having a baby. A friend of mine planned to go to Las Vegas on a guy's trip 2 weeks after the birth of their first child. 2 weeks. To say this was optimistic is putting it lightly. To say this could have been dismissive of his partner in planning this trip is a little more accurate. You don't know what parenting is going to be like until you're there. For at least a few months afterwards, a mom is still recovering from birth, possibly a C-section, and you have no idea what state things are going to be in. The proverbial shit may be hitting the fan and you're off partying in Vegas. That will not be easily forgotten by any woman. The opportunity for a deep resentment to set in is just too high to take that chance. Note to partners, resentment is the number 3 cause of decreased sex drive in women. It's right after sleep deprivation and stress. Once resentment sets in, it takes a long time and a lot of work to repair. Even if before she has the baby she tells you it'll be fine for you to go, she has no idea. Neither of you has any idea what parenting is like until you're there. I wouldn't chance it. That trip can wait. Stress reduction for mom. While there are everyday chores that require tending to, there are also bigger duties of parenting that take up mental stress. These include figuring out childcare, insurance paperwork, and managing your baby's health requirements. Be a partner in figuring these items out. Help share the weight of these burdens. Help interview nannies and daycares. Childcare is a stressful decision because it comes with lots of fears. Will our baby be safe, loved, well-fed? Will our routines be respected? Is this person or daycare compatible with our parenting philosophy? The search to find someone to entrust the care of your baby can overwhelm a parent even when they're feeling good. If mom is depressed, these decisions can be paralyzing. If you could only do one thing to help your partner, this is it. Support her in finding ways to sleep. Getting sufficient sleep is a critical part of treating PPD. Make sure you know how to give your baby a bottle so you can feed the baby and she can sleep through the night sometimes. Learn ways to comfort the baby when she or he cries. If mom asks for you to provide nighttime care for the baby, don't complain to her after getting a bad night's sleep, particularly if she has had far more sleepless nights in a row than you have. Of course, it's also important for you to get sleep. Maybe you can take the baby on nights you don't work the next day. There are techniques to make it possible for you both to get more sleep. If you haven't seen the rest of this course, refer to the 5 and 5 sleep technique in Module 5, Lesson 1 of this Survival Masterclass. You may have gotten your hopes up that once the baby was born, you'd glide back into your prior sexual rhythm as a couple. At the very least, there'll be a mandatory 6 weeks of pelvic rest after delivery, maybe more after a C-section. It's normal for her sex drive to take a dip after giving birth or while breastfeeding. Mothers of babies and small children often feel like they've been taking care of others all day long and just want a break from being touched or tending to the needs of others. If she develops PPD, that can further decrease her sex drive. Recognize that less sex is a normal part of the early baby experience, and that as her exhaustion and sleep deprivation resolve, her sex drive will improve. Do not take her lowered sex drive as a personal rejection. Of course, that may be easier said than done. Don't wait to be asked to change a diaper or do the dishes, and do your best not to leave any of your mess for her to clean up. When you have a baby, you're cleaning all day long. If you don't want her to resent your existence, don't leave a mess wherever you go. The more you help with the burden of childcare and the more sleep she gets, the faster her sex drive will return. This feeling of being supported and valued by your partner is the antidote for resentment. Having a partner who truly has your back is sort of an aphrodisiac for women. Of course, just because you do the dishes doesn't mean you get sex that night, sorry. But it does demonstrate you support her and value her contribution to the household. And I will say it again, resentment kills a woman's sex drive. Be a team player, not another person she has to take care of in the home. In all of this, you have the same challenge as she does. How do you balance all you have to do with taking care of yourself? Know when to ask for help. She's withdrawing more and more. She isn't getting out of bed. She expresses wishes to disappear or thoughts of suicide. She says she doesn't think things will get better and seems to have little to no hope. She expresses the belief that she wasn't meant to be a mother, is a bad mother, or just can't do this. Sometimes depression in moms or dads just looks a lot like arguing. What's really going on can be lost amongst the distress. If you find yourselves arguing a lot, get more support. Ask a family member to watch the babies so you can both get a break. Also know when to seek help for yourself. Dads and partners can also have depression after having a baby. Many of the self-care techniques described throughout this course are also beneficial to dads. It's important to discuss how you are both feeling and recognize when it's time to ask for more help. You may have strong opinions about therapy, therapists, and people who use therapy. This is not the time to make seeking help seem shameful or only for the weak or messed up people. Be supportive of her taking steps to regain her strength, and you too. Getting help is part of taking back control. This is also true for your thoughts on antidepressant medications. If you've seen that as something only weak people do, keep that to yourself. You need her to be her old self again. If her doctor is recommending medications, be open-minded and trust those with the necessary knowledge. Find out her thoughts and concerns. Help her explore her options. Don't close a door or add to the shame she might feel in choosing to get treatment. Taking steps to regain your wellness is never, ever something to be ashamed of. Learn the facts about antidepressant medications. If you are interested in antidepressant medications, go to academic medicine websites to learn about them. I recommend womensmentalhealth.org, webmd.com, and mayoclinic.com for more information. For moderate to severe depression, medication in combination with therapy has been shown to be the most effective treatment plan. In the U.S., approximately 1 million pregnant women a year take antidepressant medications. Antidepressant medications are not addictive. They will not change her personality. They help her become her old self again. Recognize that you are weighing the risks of taking a medication against the risk of untreated depression on the baby. A lot of research has been done on this matter. The harm of not treating PPD usually outweighs the risks of taking medication. Understand the costs of not getting treatment. Over time, if maternal depression remains untreated, your baby's growth, cognitive, and social-emotional development may be affected. Postpartum depression is also a risk factor for maternal suicide, and her depression increases the risk of you developing PPD. This is serious business, and I can't stress enough that this is not a disorder to ignore or simply wish away, so listen to her. Try to imagine feeling the way she is describing. Help her by getting the support you both need as parents of a newborn child. Help her get as much sleep as possible. I cannot emphasize enough the importance of sleep. Learn how to care for a baby. Help her get out of bed and regain activity. Don't invite people into your home without checking with her first. Encourage her to talk to her doctor about what's going on. Depression can be harmful to relationships and marriages if depression is misunderstood or not adequately treated. It's profoundly stressful to support both a newborn and someone with depression. It may feel unfair to have the burden of caring for your baby and feel you're doing it alone, and it is unfair. PPD is unfair to you, the baby, the mom. It makes a difficult time even harder. It can be angering to see her no longer being the functional person you're used to. But understand that she may be more angry and frustrated with herself than you are. I've seen partners who minimized or didn't try to understand what their wives were experiencing. This can further deepen the divide between you. I've also seen women come out of PPD with a deeper bond and appreciation for their partners, knowing their partner was supportive and there for them in their darkest time. This can create a shared sense of appreciation for one another. If you take nothing else away from this course, know this: how you respond to her and to PPD matters.